aware of the term mobile health, quite different from India's elite, the cream of the cream of the cream of Indian society who are not aware of mHealth. 82% of patients with poorly managed conditions engage in some sort of mHealth versus 64% of those who were surveyed. I love this national telecom policy, Government of India. Even setting aside certain hyperbole, which all politicians are accustomed to, which we are accustomed to, still, just look at this. It says, the Government of India says, this is an instrument of empowerment. Gone are the days where a mobile phone was used to communicate. This is an instrument of empowerment which will ensure that the GDP of our country considerably increases. 61% is already the rural teledensity of India, and I think this is a fantastic opportunity. We have to totally think outside conventional lines. You have been hearing this in the last 8 sessions. Here is a demonstration which I got a couple of weeks ago from an Israel company. This is one of the people working with me, a 12-lead ECG. Hitherto, you required a technician or a nurse to put in the 12 leads. It does require a certain amount of technical skill. But today it is commercially available. You just put a belt around, small, medium, large, men, women, different sizes, and in a couple of minutes, the message can go to any server anywhere in the world, and you get a totally automated analysis of an ECG. Again, you're all familiar with heart attacks. I do not know how many of you are familiar with brain attacks. Today, if we are able to diagnose it in time, you can prevent a stroke from occurring. Neurosurgeons, anyone, anytime, anywhere, can be the slogan if you just have a smartphone. Again, ultrasound, there's no problem in getting ultrasounds done in rural India, but it's extremely difficult to get somebody who is able to actually evaluate it. Microscope, tuberculosis, malaria, you name it, every one of them. Getting a smear is not a difficult job, but getting somebody to interpret it is extremely difficult. And today for $5, you can convert your phone into a microscope. Ladies and gentlemen, the phone is going to be the handheld hospital of the future. Unfortunately, India has a maximum number of blind people, not because of cataract, not because of diabetic retinopathy, but simply because they have refractive errors, which all of us get once we become 40, 50, and we do not have enough optometrists. It's so simple today by a series of iterations, bring the red line over the green line, and the sequence of movements which you get, the software will tell you precisely what is your refractive error. Again, I can go on and on. Today, asthma, you can cough into a phone, and based on acoustic vibration analysis, you will be able to get a diagnosis. You can spit into a phone, and the saliva there will automatically be analyzed. Personal health, mobile health records. I'm again very happy that Apollo has taken an initiative in this, and I understand that this afternoon we'll be formally announcing this. I was taught when I was a medical student that an apple a day keeps a doctor away. Today, I think an app, probably every few minutes, will keep the doctor far, far, far away, and I'm certain I'll be out of a job. Again, imminent cardiac arrest. Thousands of lives, no exaggeration, thousands of lives can be saved if only we knew how to do a CPR. Today, you can get an application where the CPR is available on your smartphone. Based through GPRS, you can find out exactly where the nearest defibrillator is. All this does not require too much of education, too much of sophistication. Just look at this. AED located at the vending machine at basement 1. You are in a mall, you get a chest pain, and you know exactly where the AED is available. So I think these sort of applications are going to become more and more common, and eventually we are going to have an application for everything. Every one of this is available today. It's only a question of time. Again, the phone can be converted, as I told you, you don't have to wait for 48 hours to find out whether you're pregnant or not. All you have to do is to give a urine sample, put it into a sensor which can be fitted into the phone, and instantaneously you will know whether you're pregnant or not. Almost so many lab applications today can be converted. I'm sorry, I think there's been a little... Oh, what happened? Okay, I think we'll stop with this. I think there's been this thing. So basically the message I wanted to convey was that the phone can be used as a handheld hospital, as a laboratory for future. And I'm absolutely sure this is going to become a reality, maybe a couple of years, but sooner than later. Thank you once again. I'm sure we'll have some time for questions. No. Can somebody hand over a microphone? Please announce your name and where you come from. About it. In one way, I'm very happy that the DIY concept, I said that the doctor is being brought down from the pedestal tower in which he was all these years. But a word of caution that a human being is still required to interpret this, and though many of these applications are extremely sophisticated, we have to understand that mobile health and application is a tool to achieve an end. It's an enabler, and I shudder to think of the day when an application is used in lieu of a healthcare professional. So we must be very clear in our minds, both the doctor and the patient, that this is only a means to achieve an end and not the end by itself.
Right. Thank you. Other questions?
Have to reassemble by 1:20, 1:25 at the latest. The security is taking over this and the Chief Minister is expected at 1:45. May I once again please request all of you to be here at 1:25. Thank you so much. Thank you, Dr. Arun Rai, for this.
Thank you.
Exciting time it is, how much we can learn, how much we can share. But the whole idea has really been to cooperate with each other, to find ways to work together, to collaborate with each other on ideas, but most importantly to innovate. And Mark added one dimension, to innovate responsibly. So I'm extremely happy to be here moderating a session with a panel which I think is some of the most interested, involved and capable people in healthcare, handling the idea or the concept of how we can use and apply information technology to enhance patient safety and improve healthcare. So I'm not doing any formal introductions because I think all of you are very well known to the environment at large. I'm going to be going across the group and asking you to please make a 1 to 2 minute statement on what you feel about this subject, and then we'll slightly throw it open. We will possibly be concluding the session fairly abruptly without too much time for questions because the Chief Minister will be joining us, at which point we move off stage and the Chief Minister's function starts kind of flowing seamlessly through. So I'm giving you a heads up on what to expect for the next 25 to 30 minutes. I will start with Mr. Shankar Sharma because he seems to be ready with the mic here. So Shankar Sharma is a director with Johnson & Johnson. J&J's commitment to healthcare and patient safety is well known. So tell us, Shankara, what do you think?
First of all, congratulations on hosting this patient safety conference. And it's great to see Apollo taking up this topic, keeping it
This
right
is our third year,
front and center of the way healthcare should be done.
And so feel free to pitch in,
Can you hear me?
Will make it fun.
Okay.
Keep the mic.
Sure. So to just comment on what you said, I think minimum, or it can come at a very integrated platform level where most of the decisions towards patient safety could be taken. But I think the key question before the IT is really the patient safety. And what are the elements of patient safety? What kind of environment is required to make sure that patients get the minimum standards of safety? I think those are some of the things that we should look at. And I'm sure there are solutions, there are data, there is an analysis that needs to be done, there is monitoring, there is surveillance, and IT obviously will play a greater role in that. So perhaps I think my point is more in terms of what is the enabling environment to raise the awareness in terms of the patient safety.
Okay, so enabling environment is really what Shankara is talking about. So who's going to create that environment is something we come back to next. But for now, I'm going to give the mic to Mr. Rajneesh Rohitkadi from BD. I think BD has been at the forefront of talking about safe blood collection. I remember many years ago when all of us were struggling with how do we use these fancy vacutainers from BD. But I think over a period of time, they persisted in the market and found a way that people changed the methodology with which we collect blood. So Rajneesh, tell us more. Patient safety, what do you think?
So that early days of journey with blood collection, I think, has gone way beyond into safe infusion and safe injection practices and variety of things. I think applying the concept to India, and you were there at the FICCI conference talking of universal healthcare, given the fragmented nature of both the patient base as well as the caregivers across the country, it seems intuitive that IT can perhaps become or provide the backbone or the skeletal framework around which just access to healthcare and in the process better patient safety can be provided. And I think various stakeholders have to come together to create it. I don't think it's up to any one person or any one segment of the whole industry which can do that.
Sounds good. So now I think it's the time to get the lady on the dais besides me to give us some insights. Tracy, as you all know, has an important role with ISQA, which is the International Safety and Accreditation Association. She'll give you the right inputs, but amazing insights that she delivered and shared at the Patient Safety Conference this morning. Coming with a fresh eye into India, please share with us, what do you think? What should we be doing? How do we enhance the use of IT? Where do you think we are currently on the patient safety platform compared to a global situation?
That'll take probably slightly more than a couple of minutes. I'm not an expert in India, nor am I an expert in IT, but certainly with ISQA we've been engaging with India for a great number of years. And what I would say just overall is that I'm really struck with the passion and the commitment around